Attention Deficit Hyperactivity Disorder, ADHD, is a neurological condition that affects millions of people worldwide. It is characterized by a persistent pattern of inattention and/or hyperactivity impulsivity that interferes with daily life. Although ADHD is a well-known condition, its root causes are still being researched, and it remains a perplexing disorder. In this video, we will explore the mysteries of ADHD and the latest findings about its causes and treatment. What is ADHD? ADHD is a neurodevelopmental disorder that affects children and adults. It is a chronic condition that can last a lifetime, and it can significantly impair daily functioning. The symptoms of ADHD fall into three categories: inattention, hyperactivity, and impulsivity. Inattention symptoms include difficulty focusing on tasks, forgetfulness, and being easily distracted. Hyperactivity symptoms include restlessness, fidgeting, and inability to stay still. Impulsivity symptoms include acting without thinking, interrupting others, and taking risks without considering consequences. The exact cause of ADHD is still unknown, but it is believed to be a combination of genetic and environmental factors. ADHD tends to run in families, which suggests that genetics play a significant role in its development. However, environmental factors, such as exposure to toxins or stress during pregnancy, can also contribute to the development of ADHD. Diagnosis of ADHD. Diagnosing ADHD is a complex process that requires a thorough evaluation by a trained healthcare professional. The diagnostic criteria for ADHD are based on the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which outlines the symptoms and criteria for diagnosis. To be diagnosed with ADHD, a person must have persistent symptoms of inattention and/or hyperactivity impulsivity that interfere with daily functioning. The evaluation process typically involves a comprehensive assessment of the person's medical history, symptoms, and behaviors. This may include interviews with the person, family members, and teachers, as well as standardized rating scales and tests. The healthcare professional may also perform a physical examination and neurological tests to rule out other medical conditions that may be causing the symptoms. Treatment of ADHD. Treatment of ADHD usually involves a combination of medication, behavioral therapy, and lifestyle changes. Medications used to treat ADHD include stimulants and non-stimulants, which can help improve focus and reduce impulsivity. Behavioral therapy can help people with ADHD develop coping strategies and improve social skills. Lifestyle changes, such as improving sleep habits and exercise, can also help reduce symptoms of ADHD. However, treatment of ADHD is not a one-size-fits-all approach, and each person's treatment plan should be tailored to their specific needs. It is important to work closely with a healthcare professional to determine the best course of treatment for each person. Controversies surrounding ADHD. ADHD has been a controversial topic in recent years, with some questioning the validity of its diagnosis and treatment. Some critics argue that ADHD is overdiagnosed and that the symptoms are simply part of normal childhood behavior. Others argue that medication used to treat ADHD is overprescribed and may have harmful side effects. Despite these controversies, ADHD is a real and significant disorder that can significantly impair daily functioning. The symptoms of ADHD can cause difficulty in school, work, and relationships, and can lead to other mental health problems, such as anxiety and depression. It is important to recognize the symptoms of ADHD and seek appropriate treatment if necessary. Future directions in ADHD research. Research into the causes and treatment of ADHD is ongoing, and there is much to be discovered about this perplexing disorder. Some of the current areas of research include genetics. Researchers are studying the genes that may be involved in the development of ADHD. By understanding the genetic underpinnings of ADHD, it may be possible to develop more targeted treatments for the disorder. Brain imaging. Researchers are using advanced brain imaging techniques, such as functional MRI, fMRI, and positron emission tomography, PET, to better understand the brain changes that occur in individuals with ADHD. This may lead to new insights into the underlying mechanisms of the disorder and the development of new treatments. Non-medication approaches. There is growing interest in non-medication approaches to treating ADHD, such as mindfulness-based interventions and neurofeedback. These approaches may offer a promising alternative or adjunct to medication-based treatments. Early intervention. Researchers are also exploring the potential benefits of early intervention for children at risk for ADHD. Early identification and treatment may help prevent the long-term consequences of the disorder and improve outcomes for children and families. Conclusion. ADHD is a complex and perplexing disorder that affects millions of people worldwide. While its causes are still being researched, it is clear that genetics and environmental factors both play a role in its development. Although there are controversies surrounding its diagnosis and treatment, it is important to recognize that ADHD is a real and significant disorder that can have a profound impact on daily functioning. Ongoing research into the causes and treatment of ADHD holds promise for developing more targeted and effective treatments for this challenging condition. By continuing to explore the mysteries of ADHD, we can improve the lives of individuals and families affected by this disorder. Thank you for watching. We hope that we have expanded your knowledge somewhat. It would be awesome if you would join us, comment, like and subscribe. See you next time. Have a great day.